Hi, I'm Susan McGill, and I'd like to give you my understanding of sampling and how it works based on the staff satisfaction surveys that we use at Mission Hospital where I work. Every 6 months to a year, all survey participants across Mission Hospital, regardless of where you work as a nurse and what area of nursing you're in, are given the same opportunity to participate in a staff satisfaction survey. It's totally voluntary, but everyone has the same opportunity to participate if they would like. That is a random sampling example. A simple random sampling would be if that was narrowed down to only the ICUs that had X amount of number of staff that were selected to participate. A systematic sample would be if all of the registered nurses across the Mission Healthcare system were on a list by name or by employee number, and we determined that we would select every third name on the list or every sixth employee ID number on the list. And that would be a systematic sample. A convenient sample would be if I randomly went into an ICU or a step-down unit and just approached each individual nurse until I had the number of nurses that I was seeking. Let's say I wanted 10 nurses, and I randomly approached 10 nurses until I got 10 that were willing to participate, and that would be a convenient sample. A stratified sample would be when I divided that into two subgroups. For instance, across the network of Mission Hospital nurses, I chose all of the step-down unit nurses versus all of the ICU nurses, or perhaps I chose all of the cardiovascular nurses versus all the neurotrauma nurses. And then probably the one that I like the best would be clusters, and that would be when I chose all of the step-down units across the healthcare system, but then out of, say, 25 step-down units, I selected 4 of those cluster groups, and each member of each of those cluster groups would have the same opportunity to participate.